Hi, my name is Tamara Sanchez, and I'm here today to talk to you about the Operative and Invasive Division at St. Francis Medical Center, which is at a division that has all the surgical services that are entailed that we have here at St. Francis. So I'm going to start off and then kind of explain to you what Operative and Invasive Division is. So all these different departments are all a part of Operative and Invasive Division. So the first one we have is Interventional Radiology. We have Cardiac Catheterization Lab. We have the GI Lab and Post-Anesthesia Care Unit, which is where the patients recover after having anesthesia done. And then we have the pre-op and post-operative. So that's where they're going to prep the patients and then recover those that are going home and being discharged that day after their procedure. We have main surgery, and that is actually divided up into different areas as well. So we have the neurology, orthopedics, multi-specialty, we have heart, the cardiac, and we also have the pediatric area. And then we have sterile processing, and that department's important for where they get all our supplies ready as far as sterile instruments and keep those clean and ready for us and all our supplies needed for a procedure. And then we have the Surgery Pre-Admission Center, which is SPAC, and that's who decides and puts all our charts together and looks over and makes sure everything's prepped before a patient goes to surgery, to make sure that we have our H&P, our appropriate labs, consents, and patients have instructions of where and when to come. So this gives you a little map here of St. Francis and all the locations of the operative and invasive departments inside the medical center. SPAC is actually off the medical center area, just so to give you an idea. So on the ground floor that we have the adult and peds surgery areas. We have the cath lab, and we also have pre-post PACU, and that is located in Zone 9 of the medical center, so that's the newest part of the hospital that's been added on. On the second floor is where we have the GI lab, which is actually expanded and has a lot of different bays there now, and that's also where they have their own PACU, because some of those patients for GI lab need actual anesthesia, so we have to have that PACU as well. Then we go on to Zone 0 there on the second floor, and that's where interventional radiology is located, and they have their own recovery and pre-op area in that division. And then on the third floor of Zone 0, we have the main surgery, which has their own pre-post, and they have PACU as well, all in that same area. So as you can see, we are spread out through several areas in the hospital for all these different operative and invasive divisions. So just kind of give you an idea when we talk about the process for these patients, what happens when they're going to have any kind of procedure or surgery. So first of all, it starts with the SPAC, which I talked about, the surgery prep office. And that's where they get the charts, find out from the provider's office that yes, they're going to have surgery. We need to figure out and get their chart together to prepare them. So we have nurses that call their patients at home, go over their medication, their history, and make sure they're all set to come in for the day of surgery. From that process, and then the patient shows up in admitting, and that's where they get registered and where they're going to get their labs done, x-rays if needed, and be prepared to go up to the actual area. Then they go up to pre-op, depending on what area they're going to, whether it's GI lab, cath lab, surgery. So they will go to that specific area, pre-op area. And then from there, they'll go intra-op, which is in for their procedure. And after their procedure, they go to PACU, which is Post-Anesthesia Care Unit. And that is an area where they're waking up, recovering from anesthesia. Some patients don't have anesthesia, they have local, then they'll just go bypass that area and go straight to post-op. And then some patients, once we got through PACU, go to that post-op, like I mentioned, if they had anesthesia and they're recovered and they're ready to go home, or at that point, they'll actually be admitted to the hospital and go up to their room. And then discharged to home, whether they're an inpatient or outpatient. That's the next stage of the process for our patients. So it kind of gives you an idea what happens with those patients in these areas you might have an opportunity to work in. So we have a little video just to give you a good idea what that process looks like. We have the eye of a peds patient, which is much more fun than watching an adult process. So I think you'll really enjoy watching this little video. And this is actually in our Zone 9, the pediatric ground 0 floor, where we get a patient ready. So you can actually see what the area looks like as well. So I'm going to have somebody start the video for me.
My name is Sabrina, and I want to tell you about my surgery adventure at the Children's Hospital of Illinois. Surgery is when a team of doctors and nurses work together to fix something on or inside your body. When my mom and I got to the hospital, the first thing we did was check in. I got a hospital bracelet with my name, birthday, and other information on it. It helped the doctors and nurses know what kinds of medicine to give. Then I rode an elevator to a big waiting room. A person called a concierge gave me an adventure map that showed me all the important things I needed to do at the hospital. Soon a nurse led us to the area where I got ready to have surgery. The nurse measured how tall I was and checked how much I weighed. I changed into extra clean hospital pajamas. A lot of people who work at the hospital wear extra clean clothes called scrubs so that germs from their clothes and skin don't spread to anyone else. I also got to choose a hat to wear. Everyone who goes into the operating room has to wear a hat, even you. The nurse showed me to my very own room. She checked my temperature with a thermometer that slid across my forehead and put a loose clip on my finger to check my breathing. My mom also got her very own hospital bracelet so that everyone knew she was with me. A person called a child life specialist came to see me. They teach kids about the different people and places at the hospital. She showed me a special kind of mask I'd use to breathe in the sleeping medicine that would help my body go into a deep sleep during my surgery. I got to practice using the mask before I went to the operating room. My stuffed animal Skippy got to try it too. I got to play in a playroom until it was time to talk with my doctors. There were board games, books, toys, and even video games. Then the doctor who did my surgery came to see me to make sure I was ready to go to the operating room. Another doctor called an anesthesiologist visited me too. An anesthesiologist is a doctor whose job is to give kids sleeping medicine before surgery. The medicine makes it so that your body won't feel anything during surgery. On my way to the operating room, I said, "See you later," to my mom. You can bring your favorite stuffed animal, blanket, or toy along with you. I brought Skippy. You can also choose to walk or you can ride in a wagon. The operating room is pretty big. I saw a lot of things I had never seen before. My nurse helped me get up onto the bed and get comfortable. She stayed with me until my surgery was all done. Then the anesthesiologist placed the mask over my nose and mouth. It was just like the mask I practiced with. My job was to be still and take big breaths. I closed my eyes and held on to Skippy because he helped me feel safe. After I took some big breaths, my body went into a nice deep sleep. It was different than the kind of sleep I have at home because the sleeping medicine made it so that my body didn't feel anything that happened during my surgery. When I woke up, my mom was there with me and a different nurse was taking care of me. She was really nice. I noticed a brightly colored bandage on my hand. It was protecting something called an IV. An IV is a very tiny straw or tube that helps give your body medicine and water while you are in the hospital. I also noticed some circle stickers on my chest. They were called EKG stickers. EKG stickers help your doctors and nurses see how your heart is working during surgery. There was also a Band-Aid with a red light called a pulse oximeter. It was wrapped around one of my fingers. A pulse oximeter shows how well your body is breathing. Sometimes your body may feel a little uncomfortable after surgery. It's important to tell your nurse or a grown-up if a part of your body is hurting so that they can help you feel better. I was in the wake-up room with my mom and my nurse for about half an hour before they gave me a few jobs to do. My first job was to sit up in a comfy chair. My next job was to have something to eat or drink. Some kids get to go home on the same day they have surgery. Others spend the night in the hospital to make sure their bodies are healthy before they leave. At first, I was a little nervous about my surgery. I realized there wasn't anything to be nervous about. When I got back to school, my teacher let me tell my class about the adventure I had at the Children's Hospital of Illinois.
All right, so Sabrina's story there gives you a little bit of idea of the process and the different roles. As you saw, the nurse that got her ready, you saw the nurse that took her back to surgery, and then you saw the nurse that was in PACU, which is the sleepy wake-up area she talked about. And then back to post-op phase 2 is where she recovered. They gave discharge teaching and sent her home. So you can see there's a lot of different nursing roles in these areas that you can do, and it's pretty much the same process for the adults as well as for the different areas like interventional radiology, GI lab, cath lab. So it just gives you a little good overview of what that process is and what kind of roles you could be playing in these different areas. So some of the things, you saw some of the things that the nurse did, but here you can see some different things as a nurse in these areas you do. There's so many things you don't realize that you have to make sure taken care of before a patient goes to surgery. So a lot of things you do, they have a pre-op checklist and different things that we go through with them. We have to do their pre-op teaching or post-op teaching, consent form, make sure they have anything to drink or eat, and they're in a gown. All their belongings are off. We've checked their medications, done lab work and verified those as well. And then we've got post-op vitals that we do afterwards, so we have to do some ahead of time so we have a baseline. So we go through all those things, and if you're an intra-op nurse, you're going to verify all those things are taken care of. So there's different opportunities to really use your critical thinking when you're taking care of these patients post-op, pre-op, intra-op. So this is, you saw in the video, a little picture and diagram of what the intra-op environment looks like. So you have, it's a sterile environment, and there's a lot of equipment in there, and you have equipment for the anesthesiologist, their machine, and then you also have their medications, and they have a bear hugger if they need it, IV fluids, you've got the big lights up above, and you have the table for them putting on for the procedure. So all of them have these different equipment in each of the rooms, so if you would be interested in a nurse in the surgical environment, you'd have to get used to working in this area and having to gown, mask up, and keep sterile while you're in there, so if you're going to circulate in the rooms. So this is kind of what that environment looks like if you enjoy those type of areas to work in. Cardiac cath lab is just a little bit different because they don't necessarily, most of their patients are awake. They don't always sedate or have anesthesia. They'll just have like a local or some fentanyl and Versed. So these kind of patients, there's a little bit difference as far as when they're awake for the procedure. They're kind of sleepy kind of environment, but they're not totally out. So this just gives you an idea, and this is an image of them when they're doing a different procedure, and they have a whole group because it's a big important surgery that they're doing a procedure. And then on the right there, you'll see a picture of a coronary artery. So they actually go in there and they have to have different equipment because they're actually going to do imaging and take pictures as they inject dye and look and see if there's any blockages in those hearts, or also if it's a device and they got to see where that pathway is for their arteries and veins and where they're going to put those leads. So that's kind of a little different environment that they have, and they can actually have more people, except probably not today, but sometimes they have to have that whole group there. So some of the procedures they do in the cath lab, just to give you an idea, and I specifically like to discuss this because that's where I've spent the most of my career at, was in the cardiac cath lab, pre-oping, post-oping, and I also circulated in the rooms. So had a lot of great experiences there and opportunities to learn. And then we also do some sedation procedures, procedural sedations that the nurses sedate, which is transesophageal echocardiograms, where they put the scope down and take images and determine if they have any clots in their heart, if they have any problems with also how their heart is pumping as well, right? And then the cardioversions we have that we actually shock them out of irregular rhythm, so we do a lot of those in that department as well. And that would be usually anesthesia sedate for those. And then cardiac angiograms we talked about, stent placement, ballooning. We do ablations where they ablate abnormal pathways of the heart that are causing cardiac dysrhythmias. And then we have implantable cardiac defibrillators to help prevent any cardiac events, pacemakers, temporary pacemakers, renal and peripheral angiograms, stentings and balloons. We have valve repairs, aortic and pulmonary, and they have an opportunity to do that without actually going to open heart. They can go through there and do that valve repair without having to open their chest. And then pericardial centesis, and then they do balloon pump insertions for those that need that temporarily, have that when they've like had a heart attack, things like that. And then a Watchman procedure for atrial fib, where they're able to take care of where that atrial fib problem is going on and preventing clots from forming in there. So just to give you an idea about what kind of patients, because I know there's a lot I could tell you about that I took care of. This kind of just gives you a little idea from a peds point of view, because you don't realize cardiac also is pediatric population, and just to kind of let you know kind of what they go through in their process in the cath lab. So if we could play that video now, this gives you a little insight of one person's Mila
Mila was
story.
born on June 27, 2012. She was born with multiple congenital heart defects. Over the course of the last 4 years of her life, she has endured 7 open heart surgeries. Mila was diagnosed with her congenital heart defects when I was pregnant. They were actually able to diagnose about 4 of her heart defects just at 28 weeks.
As soon as Mila was born, they took her. I went with them watching her. They got her stable, got everything going, got her all the medicine that she needed.
At 2 weeks old, she had her very first open heart surgery.
Yeah, the goal of the first surgery was that they shunted up her aorta to get her oxygenated blood, and just basically to get her bigger so they could do the more advanced surgeries.
Because Mila's heart disease was so complex, she required multiple operations throughout her childhood. Each operation in and of itself had been successful in that it allowed her to grow and develop and get to sort of the next stage.
She had an MRI done to print out a 3D heart model. This 3D model helped diagnose one of Mila's rare heart defects.
The anatomy in the operating room was, of course, exactly what I was anticipating to see. So this whole 3D modeling study up front reduced the time that we had to stop her heart in order to correct the defect.
We continued to see the cardiologist for ultrasounds. The muscle of her heart was squeezing adequately to circulate her blood. And then there were some questions to if her tricuspid valve was working properly. And right away the doctor said, you know, we're going to have to replace this valve. We want Mila to have a good, successful future, and we're going to need to replace it. That was really scary for Jeff and I, because she'd had so many open heart surgeries, and we feel like we had tempted fate so many times that can she withstand one more?
So that is when we discussed amongst ourselves about what would be the best option for her in terms of replacing her tricuspid valve. So there are 2 options right now. One is doing a surgical replacement, and the other is doing a replacement using the Melody valve, which is a transcatheter pulmonary valve, to place it in the tricuspid position.
That was very exciting for us to think that it might be a possibility that she could give Mila one of these valves. But we knew also that Mila was very small.
I had to modify the Melody valve for her case because she is small, so her heart is small, and the Melody valve is long. So I had to fold one strut of the stent to be able to put it in her case, and it worked out great for her.
She not only put it in a 4-year-old, but put it in a totally different space than it was meant for. And the next day, Mila woke up, she ate, and we were told, you can go home. And we were like, no, we can't go home. It's only been a day. And the doctor said, no, it's functioning great. She can go home. So we went home, And I took Mila out of her car seat when we got home. And she looked at me and she said, "Mom, I can breathe." And I broke down. I cried so hard because just to think that my 4-year-old daughter knew the difference between a good breath and a bad breath.
So you can see there with Mila's story, what an impact you can have working in these divisions and having the opportunity to be in those procedures. I know sometimes when I worked in this area, you didn't always get to see the outcome, so it's kind of nice to see a story so you can really see how what you've done impacts that patient's life and how they have an opportunity to improve. So that's what procedural areas do. They really help people and give them the opportunity to have better life and have an opportunity to take care of some of these problems that they have, that we can fix them and hopefully get them to a better lifestyle. And as you can see with this, these patients also bridge over to the adult population. So the ones that have congenital hearts, actually we see in the adult side and also do procedures on them as well. So it does flow over to their care the whole time, but they always need to be seen at some point. So Mila's story is kind of a neat one. So just to give you a little idea now, we didn't talk a lot about the cardiac, but what impact you can have if you work in this kind of area is, of course, everybody probably knows the big thing is heart attacks, right? We're trying to prevent those. And here at St. Francis, we're very proud to say that we have really gotten the door to balloon time, which means the time that the patient enters the hospital to the time we get them in the lab and they actually open that blockages, right, at that time that they need. They put that stent in and that blood flow gets going again. So here at St. Francis, our goal to balloon time from the moment they open is less than 60 minutes. National average, their goal is 90 minutes, so we set the bar lower. We wanted to have a shorter time span. So right now, our average is for 2020 is 48.5 minutes, so we're well below that. So that's been an awesome goal, and a lot of that has to do with the nurses that work in that area because they have to be there quickly and promptly to do those procedures, even during the night, and come in and make sure that we get those blockages open. So there is call involved, but it also you're impacting patient and patient outcomes, and we see that. And every time that we take time off, every 15 minutes we take off, really decreases the damage to that heart. And then we have 15 different smaller hospitals that feed into St. Francis where they send us patients. So that's why we really try to keep that time down as we move from the time they might come from another hospital actually and come to us. We've had patients come from the ED, they don't stay in ED, they come straight up to us. And I've seen them where ED's on the cart giving compressions as they're coming through the door. You're like, okay, we got to get moving on this patient. So time is muscle. So we get them in that cath lab, get those blockages opened, and you know it's very important to those family members that we do everything we can to give them the best care. So it's a great, rewarding area to work. So what does it take to be an operative invasive nurse? I kind of wanted to give you an opportunity to have an idea. So they like you to have a little experience, so this is something you could have as a goal you could work toward. So most of them like the pre-post phase, they prefer 1-year experience. They do take some nurses that have a little less than that if they feel like you are ready for that kind of role. They do want you to have ACLS or PALS after you're hired. The PALS is for the pediatric patient population that you would need that. And the advanced cardiac life support, of course, is for the adult population. And then PACU phase 2, they want you to have some critical care experience, your ACLS and PALS for those areas. And then for surgery intra-op, they prefer some kind of experience, but they, 1 or 2. So mostly if you can work on a med-surg floor, intensive care unit area, step-down area, all those areas, you can able to transition to these kind of roles in a couple of years once you just get a little bit of experience just to help you. And then cath lab, they prefer critical care experience, and you're going to have ACLS and PALS as well. And interventional radiology and GI lab, they like 1 to 2 years experience. And if you want to work in the chart prep office, they like you have a few years experience as well. So these are some goals that you can work toward if you're really interested, because they're very exciting, rewarding areas, and it's a little different type of nursing. So this gives you an idea of what other kind of nursing there is out there. And so I hope you really do consider this opportunity to move into the surgical procedural world as a job opportunity. So thank you for listening to me today. I appreciate your time. Have any questions, you're welcome to reach out to me. So thank you.